Today, there is a coronavirus or COVID-19 pandemic. If you need to go to the hospital, you need to be prepared. This guide is to help you be prepared for your hospital visit. Because of the pandemic, hospitals are changing and will be different now. Before the coronavirus pandemic, hospitals had good services that help you communicate clearly. And ask you what services you need. This might include in-person sign language interpreters, video remote interpreting or VRI, lip reading, written communications, text, captioning, or CART. Now, during the coronavirus pandemic, most hospitals are very busy seeing a large number of patients and often cannot provide the same services like before. There are new rules now. Many hospitals will not allow in-person interpreters. Family members or visitors cannot go in with you. You may be alone for a long time when you are in the hospital. Most doctors and nurses now wear masks and gloves and may talk to you from behind a window or curtain. So it may be harder to communicate. You have the right to decide your care. This means you will need to bring a few things to the hospital, including communication tools. Print out a page saying you are deaf or hard of hearing, and need hospital staff to communicate with you differently. If you have a smartphone, you need to bring this with you. Before you go to the hospital, download several VRI apps and/or speech-to-text apps. Some of those apps are free. A list of apps is available at the end of this document. Before you go to the hospital, you need to first test the apps to be sure they work well. Keep in mind that some hospitals may not have Wi-Fi. You may have to use your smartphone using your cellular connection. When you get to the hospital, ask hospital staff to let you use their Wi-Fi. If you go to a hospital room, make sure that room is an area with strong Wi-Fi. Tell hospital staff to communicate with you through your smartphone with VRI or speech-to-text apps. If you do not have a smartphone, bring papers or whiteboard, or ask hospital staff to bring papers or whiteboard to write on. Bring an emergency bag. Label the bag with your name and write on a piece of paper a list of items that are inside the bag. Label each item with your name, including cables and other things. Label each item. Leave space on the label to add your hospital room number. The emergency bag can include paper and pens, whiteboard and markers, plugs and chargers for your smartphone, laptop, or tablets, a cellular hotspot in case the hospital Wi-Fi is not working, an extension cord or power strip in case your bed is far from an outlet, extra eyewear supplies you might need, such as reading glasses to read the speech-to-text on a phone app, extra batteries for your hearing aid, cochlear implant, or assistive listening device. If you have an advance medical directive, please put a copy of this in your bag. You can find more information and instructions to make an advance directive on AARP's website. Emergency contact information for family members or friends. If the hospital staff refuses to communicate with you or does not respect your wishes, demand an ethics consultation. You can also contact consumer groups at dhhcan.org for help. We are sharing a short list of known applications in ABC order. While we do not endorse any specific tool or vendor, there are separate lists for people who use sign language and people who speak, listen, and lip read. It is important to test and practice any application before you go to the hospital. Please print the Deaf or Hard of Hearing medical placard. I am deaf or hard of hearing. I do not understand you with your mask on. My name is... Here is my identification card or driver's license. Please speak into my smartphone. I am using it to understand you. Please respect my legal right to understand you and participate in my care by allowing me to use the smartphone. If my smartphone is not working well or at all, please write down what you are telling me.